Welcome back. Thanks for staying with us. One of the consequences of the COVID-19 pandemic has been an increase in medical waste. The challenges for the island's sole facility that handles this waste has been made worse with the spike in COVID cases over the last 2 months. Now, the Ministry of Health is trying to prevent a possible public health crisis by employing the services of the National Solid Waste Management Authority, NSWMA, and a private company to help. Here is Kirk Wright with that TVJ News exclusive.
Years ago, hospitals stopped burning medical waste on their compounds, citing environmental concerns. The government then built this medical waste treatment plant on Drummond Street across from the Kingston Public Hospital to treat infectious medical waste from all hospitals island-wide. The medical waste treatment plant is the only such facility in the island, and now it's struggling to cope with the increased medical waste brought on by the pandemic. We asked the Permanent Secretary in the Ministry of Health, Dunstan Bryan, about the severity of the problem.
The problem is significant in that over the last 2 months, there has been a significant increase in the number of medical waste that has been generated and is in need of disposal or treatment.
We took our cameras to the rear of the Victoria Jubilee Hospital, where we saw loads of the infectious medical waste stored, waiting to be collected. We can't say what was burning, but we observed smoke going into the atmosphere from their chimney. We also took our cameras into the skies over the St. Joseph Hospital in Vineyard Town, St. Andrew, where we observed infectious waste waiting to be collected. Our information is that the same is true for other hospitals across the island. The Permanent Secretary says 2 short-term measures are being implemented to ease the problem.
One would see the engagement of the National Solid Waste Management Authority for the disposal of non-medical waste, and we will be engaging a private firm that is in the business of medical waste management to provide or augment our capacities in the short term.
The NSWMA says it no longer buries the medical waste from hospitals, but they are covered as quickly as possible. We asked the NSWMA chief, Audley Gordon, about the possibility of people on the dump coming in contact with medical waste and contaminating themselves.
The pickers, they earn a living that way. We have tried in the past to discourage them, but yes, it's easy to talk. It's a difficult thing to tell a man to give up his means of survival. So what we did was to educate them as to the dangers and to advise them to use gloves and get the disposable gloves, and to also wear a mask while they're picking. Some comply, I am sure majority don't, but they can't say they weren't warned. But yes, there is a danger.
Kirk Wright, TVJ News.